Go. I'm going to share my screen. So it's nice to be here with everyone today. Okay. Can I get a thumbs up if you guys can see that? All good? Okay, perfect. So hi everyone, and thank you for having me here today. I'm looking so forward to discussing the COVID-19 vaccine with all of you. I will present for 15, 20 or so minutes, and then Dr. Jia Hu will step in for a Q&A session after that. So this is to let you know that all the information in this presentation is up to date as of today. New information is being released constantly, so if you want to stay up to date, head on over to our website. We update it every day, pretty much. So a little bit about us. I know this might be a bit of a repeat, but we are a group of health professionals and community members working to shift public perceptions around COVID-19 and behaviors in vaccination. We've been working very hard over the last year and a half to continuously provide everyone with the most up-to-date information and resources. So this is a bit of an overview of what we will be chatting about today. Feel free to write your questions in the Q&A box. It should be on the bottom of your screen there, and they will be answered after the presentation. So I like to start off always by showing this slide. So it just shows the number of COVID cases since January of 2020. You can see where we once were in the peak of COVID-19 cases to where we are now. So it's kind of cool to look at, a nice little graphic. And here again, it's just COVID cases by age group, just something good and visual to see. So as of December 1st, 2021, over 60 million doses have been administered in Canada, with more to come as more and more children get vaccinated as well. This slide is one of my favorites since it's so impressive, and it's really interesting to see how each province and territory is doing. So having questions and concerns is very natural. So that's why Dr. Hu and I are here today to answer all your questions and concerns. This is a no judgment zone, so ask away. So why get vaccinated? There are three main reasons. So one, vaccines will help us end the pandemic and return to normal. I'm sure we're all tired of wearing our sweatpants every single day. To keep healthy, to protect our most vulnerable, and to keep yourself, your friends, and your family safe. So this graph here shows the willingness to be vaccinated. And as you can see that over the course of a year, willingness increased from 46% to 86%, which is amazing. All right, I'm gonna get into the meat and potatoes of it all. So what is herd immunity? So herd immunity occurs when a large portion of the community, AKA the herd, becomes immune to a disease, making the spread of disease from person to person unlikely. As a result, the whole community becomes protected. So there are a number of factors that determine herd immunity, such as the transmissibility of the virus, the vaccine supply, the vaccine rollout, and the vaccine immunity. So while it was originally reported that we would need around 75 to 80% of the population to be vaccinated in order to achieve herd immunity for COVID, this number is likely higher. We are still trying to determine what that number is, but so this was a question that we've seen circulating quite often. So was the vaccine too rushed? No. There are a number of reasons we were able to get the COVID vaccine when we did. So one, the global effort with the world's leading scientists, and they were focused on this one task. They had nothing else to do but the COVID vaccine development. We had nearly unlimited resources, so unlimited money, knowledge, manpower, technology. We had a large pool of diverse adult volunteer trial participants, and we also had priority. We did not have to wait a long time for the vaccine to pass through the administrative steps, but no safety steps were skipped at all. So like I just said, no steps were skipped. Although it feels very rushed, we can assure you that it was not rushed. So what are mRNA vaccines? So mRNA vaccines are the Pfizer and Moderna vaccines. These vaccines give instructions for our cells to make the spike protein, which is found on the surface of the COVID-19 virus. So the spike protein on its own is completely harmless. So our body is able to recognize that this protein should not be there, so it builds antibodies, so your natural immunity. The mRNA cannot change your DNA. It is protected in the nucleus of the cell. So it won't change your DNA at all, so it's totally fine. So both the Pfizer and Moderna vaccines are effective. Pfizer provides approximately 95% protection against COVID and 95 to 100% protection from severe COVID. Moderna provides 90 to 94% protection against COVID and 95% protection against severe COVID. Overall, both of these vaccines are very effective in reducing the likelihood of both COVID and severe COVID. So this is a little bit sciencey, but one study of around 4,000 healthcare and essential workers participated in this one study, which looked at the effectiveness of preventing infection after 1 or 2 doses of the vaccine. So vaccine effectiveness against the infection was approximately 90% after 14 days after the second dose. And vaccine effectiveness of a single dose was approximately 80% after 14 days after the first dose. So some pretty good numbers we have there. So this table just compares the effectiveness of the vaccines against COVID and against the variants. So as you can see, after being fully vaccinated, you are around 90% protected against COVID as compared to unvaccinated. So vaccines do work. Only 0.5% of fully vaccinated Albertans have been diagnosed with COVID-19. That is a very small number. 78.2% of cases since January 1st were unvaccinated or diagnosed within 2 weeks from the first dose. 78% of hospitalized cases since January 1st, 2021 were unvaccinated or diagnosed within 2 weeks. And 67.4% of COVID-19 deaths since January 1st were unvaccinated or diagnosed within 2 weeks from the first dose. So here again, those who are unvaccinated make up the majority of ICU and non-ICU hospital admissions. So that's what you see in the red here. So again, that's just showing you the differences between the vaccinated and unvaccinated. So variants of concern. So we have all heard about the Delta variant. It is still the dominant variant at the moment. So what we do know, so we know that this variant is more transmissible and may lead to more severe disease. We also know that vaccines may not be as effective against this variant. However, you are still more protected against this variant if you are vaccinated compared to if you are not vaccinated. So here you can see the effectiveness among adults aged 18 and older from June to August 2021, when the Delta variant was the most common strain. So vaccination was effective in reducing hospitalization. I know these are a lot of numbers, but they're pretty interesting to see. Now, the most recent variant, so the Omicron variant, is quite new in the past couple weeks. There are still unknowns about this variant since it is so new, but it could potentially be more infectious, more vaccine resistant, and could cause greater risk of reinfection compared to the previous variants. But we do not know the magnitude to which this occurs. And further studies are required and are underway to fully understand the characteristics of this variant. I know it's scary to know there's another variant out there, but we know enough about previous variants that we can definitely handle this variant as well. So the vaccine prevents people from getting infected without symptoms, meaning they are less likely to spread it. So 1 dose of an mRNA vaccine can reduce symptomatic infection by 60 to 70%. And a single dose can prevent the spread by 50%. So pretty good numbers there. And I'm sure you've all seen the term third dose and booster out there. And I would like to explain the difference just because there is some confusion about it. They are different. So a third dose is used when the initial immune response following the first and second dose is likely to be insufficient. So a booster is the administration of a vaccine when the initial sufficient immune response to the primary series, so dose 1 and dose 2, has likely to have waned over time. So you'll hear, in the news about boosters because perhaps it's been over 6 months or a year since, people have gotten their COVID vaccine. Whereas some people that have health problems or immune problems, they need to get a third dose to make up for the first two. So Albertans with specific conditions are now eligible to receive a follow-up vaccine, a minimum of 8 weeks after their second dose. So those who have transplants, chronic kidney disease, they're in active cancer treatment, taking certain medications, are all eligible. So side effects and expected immune response. So this is a great chart, which I love, that compares the side effects of different vaccines. So in the first yellow column that you have there, that's the Shingrix vaccine for shingles. And that actually has more reported side effects compared to any of the COVID vaccinations combined. So very interesting to look at. Side effects of the COVID vaccine occur typically within 6 weeks of vaccination. It is very common to have a sore arm, like when you get your flu shot. 1 in 100 people categorize this soreness as severe pain, so not a huge number. Other people will feel tiredness, aches and pains, and fever, and this is just a sign that your immune system is working, and it usually passes and you're back to your usual self within a couple days. Something important though is that the vaccine cannot give you COVID-19 or any other infection. So if you start to feel ill and you're still feeling ill after a couple of days, it's best to go see your doctor just to get checked to see if you have COVID or some other underlying condition as well. So typically 8 in 10 people complain of a sore arm, 5 in 10 complain of feeling tired and having a headache, but most symptoms are mild, just kind of like any other vaccine. So another question that is posed a lot is about allergies. So the risk of anaphylaxis is between 1 to 5 per million doses. So if you have a history of anaphylaxis and you are unsure if it will be safe, your family physician will have the best answer for you. The vaccine is safe if your allergy is not specified in the ingredients list of the vaccine. So like I mentioned, vaccine side effects occur within 6 weeks. Protection seems to last a minimum of 6 months. That's what we know so far. This could change in the future. And it is definitely understandable to worry about the long-term effects, but so far, and from previous vaccines and previous mRNA studies, we do not have any evidence that side effects would be noted longer than 6 weeks post-vaccine. So we are starting to understand more about COVID-19 and the long-term effects. So long COVID or post-COVID syndrome has been described in as many as 1 in 4 adults who had COVID, including those who only had mild COVID. So most of these people are previously very healthy and fit and have no underlying health conditions. And we are seeing long COVID being described more and more in children as well. So long-term effects are organ damage, shortness of breath, decreased exercise tolerance, extreme fatigue, debilitating headaches, brain fog. And we're seeing it more and more in children, and they're missing out on school as well, which is also not good. So if side effects are present after any immunization, not just the COVID vaccine, they are monitored, recorded, and assessed by the Canadian Vaccine Safety Network. So all of these side effects are taken into consideration, and they're all reported in a proper manner. So nothing is hidden, everything is public. All this is public information. I can always post a link later if anyone would like to have a look if they're concerned. So we're going to briefly discuss vaccination in children. I'm only going to chat about this just because it's so new and so recent. So children under 12 now account for the highest number of new COVID-19 infections in Canada. So far, 2,000 children have been hospitalized in Canada from COVID-19 so far. So children are making up 20 to 30% of COVID-19 cases in most areas of Canada and the USA as well. In the USA, almost 4 million kids have been infected and over 500 children have died. And it's not just the flu. So COVID is currently in the top 10 cause of death for children. COVID in children has accounted for 2% of hospitalizations. Like I said, 2,000 Canadian children have ended up in hospital. And of those hospitalized, 1/3 had no pre-existing underlying condition. And long COVID affects 2% of kids as well. So can these vaccines be given to children? Yes. So Pfizer and Moderna reported an efficacy of 100% in adolescents 12 plus. The immune response to this vaccine was very strong, which is very positive news. So, and children aged 5 to 11 can also get vaccinated too, which is very exciting. This is new in the past few weeks. So why do children need to be immunized? Similar to what I said in the first few slides, but to protect their health, to prevent virus transmission, to protect the broader community, and to return to in-person learning, which is so crucial right now to these children. So far in the US, more than 4 million children have received at least one dose of the vaccine. So we're getting there, which is really, really exciting. All right, so the Society of Obstetricians and Gynecologists of Canada has recommended the vaccine for pregnant and breastfeeding women. Pregnant women with COVID-19 are actually at a higher risk for severe disease, hospitalization, and ICU admission, as well as pregnancy complications. Pregnant women with COVID-19 are 22 times more likely to die compared to pregnant women without COVID-19. So there is no evidence that COVID-19 vaccines will affect fertility either. Ideally, pregnancy should be planned 2 to more weeks after the vaccination, just to ensure the full benefits of the vaccine are there throughout the pregnancy. So again, a little science tidbit here, but there is a protein in the human placenta that has tiny similarities to the DNA of SARS-CoV-2 spike protein. So there is no evidence that this similarity causes infertility. So if that were true, one would expect that COVID infections would cause pregnancy loss, which has not been shown. So are mRNA vaccines safe in pregnancy? Yes. mRNA vaccines do not increase the risk of adverse pregnancy and neonatal outcomes compared to women who were pregnant pre-pandemic or unvaccinated. The rates of spontaneous abortion or miscarriage are equal in mRNA vaccinated individuals versus unvaccinated individuals. mRNA vaccines do not increase the risk of congenital malformations, preterm birth, small for gestational age, or neonatal deaths. So as mentioned, the vaccine does not affect fertility. A recent study that looked at placentas of vaccinated and unvaccinated women found that there was no damage from the vaccine to the placenta. So again, some more science there, but that's really important to know that the vaccine does not affect the baby, the placenta, and is really an overall healthy choice. So common misconceptions and questions. There are quite a few, but I only included a couple here. So I'm not at risk for COVID-19 is a common one. COVID-19 is very contagious, especially the newer variants that we're still trying to figure out. Our community continues to be at risk of infection, and the continued need for strict public health rules can have a negative impact on our lives. I'm sure we're all very tired of having to wear a mask every single day, having to physical distance, and it'd be nice to get back to normal. I already had COVID-19. Do I still need a vaccine? Yes. If you've already been infected with COVID-19, the vaccine will likely help you stay protected much longer. So if you have had COVID-19 recently and you're thinking about getting the vaccine, there is a 90-day period, which is recommended just to be safe. Again, some more data here. So one study with individuals who had a prior COVID-19 infection had low rates of reinfection, but protection is not as good as vaccination. Protection due to previous infection was 81.8%, and against symptomatic infection was 84.5%. So share with others, be a role model, and bring 19toZero. And we have a little survey here that I'll pop in the chat later, but that was my brief little presentation, and Dr. Hu will be able to answer any questions that you have. And I will just stop screen sharing for a second. Perfect.
Thanks, Margaret. That was great.
Perfect. I'm not seeing any questions in the Q&A yet, but we can possibly let those roll in.
I did share one with Dr. Hu that came in via email, so he's got one to address, and I potentially got some questions if nobody else wants to speak up.
Yeah, so I mean, the question Kyle shared with me, can you hear me okay? There's like some marching band over there. Sorry.
All good.
See, it's kind of funny. San Francisco is one of the only places in North America where people generally actually wear masks outdoors. So like, it's a pretty safe place to be. But anyways, so the question I got, which is a really, really good question, and thank you, whoever asked it, was around, there's a certain staff member who's unimmunized, and what risk does that pose to clients who are fully immunized? And I'm really glad for that honesty, actually, because I mean, if there's one thing I'll say is that like when it comes to the whole vaccination debate, sometimes people get kind of ideological and angry on both sides. And I think everybody is coming from a place of wanting to do what's best for themselves and the people around them. And so the way I, approach this question is, number one, it is very good that like clients are all immunized, especially given the fact that a lot of them have risk factors like developmental delay or being underhoused. When it comes to the extent to which our current vaccines protect, so if you're vaccinated, like how much are you protected? I would say that against severe infection for Delta is pretty good, right? It's still 90% plus. For symptomatic infection, so just any infection, it's beginning to wane. And that's why you're seeing a lot of the boosters. And for Omicron, which is the big, elephant in the room, I'll just talk about Omicron real quick. We know that it's way more infectious than Delta, like we've been meeting with the South African ministry. We fortunately think it's also not more severe than Delta, which is great. But the thing we don't know is the extent to which it evades vaccines, right? So that's a big question mark we'll answer in a couple of weeks. So most people, and right now Delta counts are basically 99% of all cases. So today, I would say that most people who are fully immunized are pretty well protected. They should get boosters when they're recommended, and they're kind of recommended for everybody now. So everybody should do that. We're in a good spot. Now, when it comes to the notion of how likely are you to transmit the virus if you are not vaccinated? We talk about vaccine effectiveness in terms of preventing serious outcomes, in terms of preventing symptomatic disease, but there's also vaccine effectiveness in terms of preventing transmission. And we know that for Alpha, which was the old Delta, the UK variant, it was about 90%. For Delta, it's lower. It's more than 0, less than 90. I would say it's somewhere, I guess between 50 and 90. And so if you're not vaccinated, you're transmitting more than somebody who is vaccinated. And so, that's part of the reason why we do encourage everybody to sort of get immunized. Again, people themselves are vaccinated pretty well protected, but we do see breakthrough infection for sure. One of my really close friends actually is one of the few people who was fully vaccinated and ended up in the ICU for 7 weeks. It's very unusual, but it does happen. And so, yeah, I do think it's, people are generally protected if they're vaccinated, but they're not fully protected. And that's why we want as many people vaccinated as possible. And, for this particular question, very happy to take it offline. I gave Kyle my cell phone number to share with whoever asked it if need be. All right.
Thanks, Jia. I'm not sure if you can see the chat, or I can read them off for you if you'd like. Can you list
Yes.
all the ingredients in both the Moderna and Pfizer vaccines? I can send the CDC links in the chat, just so you can have those as well. Okay, why are they not testing people who have had contact with people diagnosed with COVID? How many people are symptomatic and still possibly infecting others?
So I would say the reason they're not testing people is, I'm a big fan of testing everybody, but that might be a government thing. When it comes to, and that's why I don't know if you guys have access to rapid tests or not, but that's something you can do even though people contacts aren't eligible. When it comes to, how much do asymptomatic people transmit the virus? That's another $1 million question, right? So we believe that asymptomatic transmission accounts for somewhere between 5 and 40% of total transmission. So like the number we often said is about 20 or 30. And so you certainly can. And a lot of people are what I call like mildly symptomatic. And so, yeah, I think it's good to test if you have access to testing, basically.
Great, thank you. Okay. If an individual initially had the AstraZeneca vaccine, then had 2 vaccines of, or one of Moderna and one of Pfizer, would you still recommend a booster?
Yes. Yeah. And the reason for that is, the mRNA vaccines work super well, and especially against Delta, actually. And so, I mean, I think everybody, NACI also thinks everybody, and Alberta Health also thinks everybody should get a full mRNA series, particularly for Delta protection. So, yes. If you had one already, why not get the second?
Thanks, Jia. Can you explain why 5 Scandinavian countries and at least 6 EU countries are pulling and halting the Moderna vax? This is concerning for people to see and trust in vaccines. When will the next halt be in the next vaccine?
Very good question. So to clarify what they're actually doing, so they're not actually pulling the Moderna vaccine. This is a great question. I love this question. So Moderna is like a double-edged sword. And so it causes more myocarditis in younger populations, particularly males. And that's the bad part of the double-edged sword. But the good part of the double-edged sword is that like it probably protects you better than Pfizer at the full dose, actually. And the reason for that is it literally has like 3 times the amount of antigen than the Pfizer vaccine. And so what you're gonna see, and NACI made the recommendation, this is public a few weeks ago, saying Pfizer should be preferentially given to 17 to 29-year-old, 12 to 29-year-olds because of the myocarditis risk. But NACI is probably going to make some recommendations saying that for really high-risk people, elderly, people in congregate settings, should actually get Moderna booster. And so Moderna is basically like, they're kind of like the same thing, but Moderna is like 3 times the dose. So yeah. And just on the topic of myocarditis, I just want to say that, we're pretty, like I am on NACI, and we're like pretty obsessed with safety. Myocarditis is still very rare, vaccine-induced myocarditis, probably 1 in 50,000, which is, again, not that common. And there's a real big difference, this is very important, between vaccine-induced myocarditis and COVID myocarditis. Vaccine-induced myocarditis is very transient. You quickly recover and you quickly regain full heart function. You may be in the hospital for a bit, but you get normal real fast. COVID myocarditis takes much longer to recover from, and many people don't actually recover their heart function from baseline. And so it's like fundamentally a very different thing than vaccine-induced myocarditis. So yeah, that's anyways.
Thank you, Jia. I see one question here. I'm not sure if it should be directed towards Kyle or about why are clients not mandated but staff are required. I'm not sure if you would like to address that, or we can move on to a different.
Great question. It is a subject for discussion. There are lots of considerations for us that make this a difficult decision to make. We are paid by the government to provide service to individuals, and we can't just break our contracts. So it might be something that we could explore on a go forward basis for new clients coming to service, but for those individuals who are presently in service, we can't simply cease to provide that service. It's an obligation of ours.
Yeah, and like, if I may, I'll add something. AHS can also not deny services to unvaccinated people. I think that would be pretty, bad. And so drawing a parallel, we at least for AHS, we got to take care of everybody. But this is why, the more we can do to encourage clients to be immunized, the better. The more staff can get immunized, the better, right? But I think, that's, we got to serve everybody, right? I think that's really important.
So how long after your last vaccination should an individual get a booster? And is the booster different than a regular vaccine?
6 months after your second dose is when you should get it. For the Pfizer, the booster is the same. For the Mrna, the booster is half the dose of the full dose Mrna. We're trying to get a fast track approval of the full dose Mrna booster actually, because it is very good in higher risk populations. It's just like super vaccine. I mean, it's no different than Pfizer, it just got more stuff in it. So yeah.
Thanks, Jia. Any other questions or comments in the chat? What's the more stuff? Someone is asking. What's the difference between the Mrna and Pfizer stuff?
Yeah. I mean, so the active ingredient in a vaccine is the mRNA, right? And so there's just more mRNA in a Mrna than in a Pfizer. Everything else is kind of like filling, right? So yeah.
Great. I'm happy with my, oh, sorry, go ahead.
I had a few questions. If nobody else has got anything at this time. I was wondering, what are some of the medical concerns that would preclude somebody from being vaccinated?
Oh, I mean, very, very few. So one is like anaphylaxis or severe allergy, okay, to vaccine component. And just so people know, flu vaccine and COVID vaccines don't share components. And when I say severe allergy, like hives, rashes, those don't count. Severe allergy is like actual trouble breathing or like, yeah, like really serious stuff. And so the number of medical exemptions, like true medical exemptions that AHS will grant is like in the range of, I don't know, like 1 in 100,000 probably, because like severe allergic reactions are super rare. I'll tell you, yeah, anyways, I'll stop. But yes, so very rare.
I think we've heard lots of stories about vaccinations being associated with a risk, an elevated risk of blood clots. Is that true of the mRNA vaccines as well?
Absolutely not. So that was just with the viral vector vaccines, which is the AstraZeneca and the Johnson & Johnson. That being said, right now, like again, COVID is associated with the real. So with the vaccines, you know, blood clots, maybe 1 in 50 or 100,000. If you have COVID, your chances of serious clotting is about 1 in 3 to 4. And so tons of admitted hospitalized patients have blood clots. And so, I mean, we don't really give AstraZeneca anymore, and we give J&J now. I think people don't want mRNA vaccine. You know, fair enough. Get what you can get. Like, get what you're willing to get. But with mRNA, there is no elevated risk of blood clots at all.
Thanks. Are COVID-19 vaccines still considered to be experimental?
So it's just like interesting, right? Like, what does experimental mean? I mean, they're fully approved by the US FDA and Health Canada, but maybe more than anything else, I'll say this, right? Like, there has been nothing in the history of medicine, other than maybe measles vaccine, that has been given to so many people so quickly, right? And that's where the data comes from, right? Billions of doses have been given, and they're really safe. And like, the reason why things are still considered sort of experimental is like Health Canada and FDA, like they have a process where things take time. I mean, actually vaccines tend to receive full approval within the 1 to 2 year mark anyways. But like, I mean, the proof is in the pudding, where like, I don't know, like billions of people have gotten this and we kind of know about it. Oh, the other thing I'll say is that, you know, Margaret mentioned that the vaccine can't give you COVID because it's not a live vaccine, it's a dead vaccine. There are live vaccines like measles. And in the history of all vaccinations, no dead vaccine has ever had long-term side effects. So, you know, that's helpful to know. So, yeah.
Thanks, Jia. We do have 3 questions in the chat. First one, should we not be respecting the Immunization Act in Canada that states Canadians are not required to be vaccinated?
Is there an Immunization Act in Canada? Anyway, there's different legislation. I mean, when it comes to this, like on one level, like we don't make anybody get vaccinated, right? There are consequences not being vaccinated, like you can't hop on a plane, but like there's no forcible vaccination. And when I think about vaccination, like it's all about cost benefit. There's another question about long-term side effects, right? And like, how can we know? And you're right, like the vaccine's only been out for about a year, right? So we don't have 20 years experience with it, but we have enough like analogous data to show that it's pretty darn safe. But when I think about the cost of not vaccinating, I mean, you just, like I managed every long-term care outbreak pre-vaccine, and every day you'd have like dozens of people dying, right? And like, you know, I just think that nothing is perfectly safe, nothing is perfectly effective. But on the balance of things, these things are overwhelmingly safe and effective. You know, after long-term care got immunized, the number of people who died fell by about 98%. And there was a lot of people who died. And so, you know, with everything, we should look at the risks, the benefits, and the benefits really outweigh the risks.
I guess maybe to add to that, like Dr. Hu says, nobody's forcing anybody to be vaccinated, but there are some things you can't do. And one of those things is be employed at CASS.
Thank you, Jia and Kyle. Another question we have here. So with the new variant being more airborne and highly contagious, how can we as staff ensure the air quality in the building is safe other than sanitizing the high touch areas?
Right. So one thing that's good about the new variant is we don't have a whole lot of it in Alberta yet. So right now, every single positive test is tested for the new variant, right? So Alberta reported its first case, but of like the 400 positive cases a day, there are no new variants, which is good. That being said, I'm confident that the new variant will take over because it is more infectious. And so, you know, it's the same stuff that we do for anything else, right? We do know that better HVAC and air circulation does lead to reduced transmission, but this is why we use a layered approach, right? So sanitization, hand hygiene, masking, vaccines, it's like we do many things. And so we want to optimize HVAC as much as possible, but you know, like it's not, no facility will ever have HVAC as good as outdoor HVAC, which is like infinite air exchanges. And I'm sure, and Kyle can speak to what has been done for HVAC things, but I think if you optimize that as much as you can, and then you do everything else, and you know, you can do a pretty good job with that. Like I use long-term cares again. Some of them are pretty freaking old, but once people were really vaccinated, we just like stopped seeing cases and outbreaks, which means, you know, we can control it, even the new variant.
Great. So if clients refuse to be vaccinated, how do employers safeguard the health and safety of their employees?
I could potentially touch on that, and maybe Dr. Hu could follow up if he feels so inclined. The same thing that we've been doing for the past 2 years. PPE, sanitization, hand washing, social distancing, all of those things are still very effective. They're all important tools in our toolkit. Likewise, we also have rapid testing added to that toolkit now as well. That's not to say that immunization isn't important, it is, and we will be making use of that tool as well.
Nothing to add. Thanks, Kyle.
Is the company willing to sign a liability waiver for any vaccine injury or death that could occur?
In short, no.
I'll give you a slightly longer answer, actually. So the company doesn't have to, but the federal government actually has a vaccine injury program that they set up. And so like this is not because we think that vaccines cause a lot of harm, but if it's more to like dispel concerns, but if people actually do receive substantive harm from a vaccine, they can actually seek compensation from the federal government.
In addition, I suppose my answer was a little bit blunt. CASS also has a number of resources at our staff's disposal. We all pay into, well, not all of us, but many of us pay into a group benefits program. We all get 12 paid personal days per year. vacation time, and of course, government assistance as well. So there are a number of resources at your disposal, but no, we won't be signing any liability forms.
Perfect. So there has been talk about graphene oxide and nanoparticles being discovered in the vaccine. Can you speak to that?
I will have to take that offline. Have them give them my email, and I'll like do some research into it. And then, what specific nanoparticle? Like, just like what specific nanoparticles? But yes, I'll take that offline.
Sounds good. I don't see any other questions here.
I think there's a question regarding rapid testing for clients, how that would be implemented. We can absolutely do rapid testing on clients, provided that they consent. No rapid testing can be performed on anybody without consent first. So should a client consent to rapid testing, we would be happy to provide that service.
Great, and thanks, Jia, for putting that in the chat, vaccine injury support. Perfect. Happy to answer any more questions. Don't see anything coming through. Kyle and team, anything you'd like to say?
Thanks so much for doing this presentation and question and answer session for us. I thought it was really valuable. I learned a few things, and I hope that everybody else did too.
Well, thank you, everyone.
Yeah, thank you so much.
And thanks so much for having us and for all the good work that you do.
Thank you, and thanks everyone for joining us as well. It's great to see so many people here.
Definitely. I will put our info email in the chat. So if you have any questions, feel free to email them. I'm the person behind that inbox. So I will make sure that they get answered or forwarded off to the right person. I'll put that in the chat now.
Yes. Oh. And happy December.
Happy
December. Snow is here. Well, yes.
Stay warm, everyone.
Yes.
Awesome.
Bye.